Why is autoimmune hepatitis hard to diagnose? Imagine trying to find a specific person in a crowded room where everyone looks similar. That's what diagnosing autoimmune hepatitis feels like. It's tricky because its symptoms can be so different from person to person. Some people have no symptoms at all, while others might feel tired, have stomach pain, or even develop sudden liver failure. This wide range makes it hard for doctors to suspect autoimmune hepatitis based on symptoms alone. Adding to the challenge are the blood tests. Autoimmune hepatitis is marked by certain autoantibodies, like anti-smooth muscle antibodies, but these aren't always reliable. Some patients may have low levels or their antibody levels can change over time. Treatments such as intravenous immunoglobulin can also interfere with test results, causing false negatives or positives. So, a blood test alone can't give a clear answer. Liver biopsies are often used to help diagnose autoimmune hepatitis. But here's the catch. The tissue changes seen in biopsies, like inflammation or necrosis, can also appear in other conditions, such as drug-induced liver injury. This overlap makes it difficult to distinguish autoimmune hepatitis from other liver problems just by looking at tissue samples. There's no single test that confirms autoimmune hepatitis. Instead, doctors relying on a combination of clinical evaluation, blood tests, liver biopsy results, and careful exclusion of other causes of liver inflammation. The criteria set by international groups help guide diagnosis, but sometimes patients have overlapping conditions, like fatty liver disease or acute liver injury, which don't fit neatly into these guidelines. Because of all these factors, experienced liver specialists often have to use their judgment. They consider the whole picture: symptoms, test results, biopsy findings, and how the patient responds to treatment. This process can take time and requires careful monitoring. In essence, diagnosing autoimmune hepatitis is like solving a complex puzzle. Its symptoms are diverse, the tests aren't perfect, and many other liver conditions can look similar under the microscope. That's why a thorough, systematic approach is essential. It helps ensure the right diagnosis is made early, so appropriate treatment can begin and help protect the liver from further damage or even progression to liver failure. Always remember, if you suspect any liver issues, consulting a healthcare professional is the best step to get personalized and accurate care.